طيب Amr, next. Okay, we will start by the definition. The fibroids, it's considered a benign tumor of the uterus smooth muscle. In other words, it's a benign tumor of the myometrium. And here is a fact that the fibroids are the most common neoplasm of the uterus. So they are very common, in which it's found in 40% of women overall. فإنه هون بس إنه definition نعرف إنها benign of smooth muscles وإنها very common. Next time. Okay, as we see in this picture, in the slide, there is a white rounded lesion, which is actually firm, surrounded by a pseudocapsule. And we call it pseudo because it's composed by compressed smooth muscle. يعني الفايبرويد زي ما حكينا قبل شوي إنها إشي من المايومتريوم وحواليها سموث مصل. لما تيجي بدها تكبر تضغط السموث مصل اللي حواليها تسويها زي الكبسول، بس بما إنه اللي حواليها أصلا هذا سموث مصل نسميها سيدو كابسول. So in slide, fibroids are usually spherical, well circumscribed, white firm, with pseudocapsule surrounding it, preferably compressed smooth muscle cells. Next. Okay, now the next is the etiology. Actually, the factors that initiate the fibroids are unknown. احنا ما بنعرف بالضبط شو الإشي اللي بيسوي الفايبرويدز. But these fibroids are monoclonal, with 40% of them with the chromosomal abnormality. Also, the estrogen and the progesterone have an important role in the fibroid growth. Yani because the fibroids have increased level of progesterone and the estrogen receptor. And as we all know, the estrogen stimulates the proliferation of the smooth muscles. The progesterone decreases the apoptosis. سامعني؟
كمل.
Okay, and تمام. And okay, because the fibroids have increased the level of progesterone and estrogen receptor, the estrogen stimulate the proliferation of smooth muscle, while the progesterone decreases the apoptosis by increasing the production of proteins that affect the apoptosis. فإنه هون إنه etiology chromosomal, monoclonal, and the estrogen and the progesterone have an important role in the growth. Next time. ما تحركش عندي.
تحرك عن natural history.
خلاص تمام. Okay. Now we'll talk about the natural history. We will talk about the progression and degeneration. The fibroids are estrogen-dependent tumors, so they are common with advancing reproductive age, and they enlarge during the pregnancy because there is a high estrogen level, and shrink after the menopause because the secretion of the estrogen will stop. فبما إنه هي estrogen dependent، الإشي اللي راح يزيد الاستروجين زي البريجنانسي راح يزيده، والإشي اللي راح يوقفه راح زي المونوبوز راح يسوي له shrink. Next time. Okay, here we will talk about three forms of degeneration in red, hyaline, and cystic. Red هي hemorrhage and necrosis in the fibroid, usually present in mid-second trimester of pregnancy with acute pain. والacute pain because of the hemorrhage and necrosis. وهون عندنا شغلتين مميزات بالرد، إنها بتصير بالبريجنانسي إنها تيجي مع acute pain، ولأنه اللي تحتيها بيكونوا asymptomatic. زي الهايلاين. The next one is the hyaline degeneration is asymptomatic with softening and liquefaction. And the cystic degeneration also is asymptomatic with central necrosis that leave a cystic space in the central. يعني هاي النكروسيس السنترال بتسوي cystic space، وعشان هيك صار اسمها يعني cystic. In the last 2 points, the degenerative changes can initiate a calcium deposition، فبتسوي calcification. ورarely بيكون عندنا malignant degeneration أو or conversion to sarcoma. To be more specific, leiomyosarcoma can occur. إنه هون أرقام تحت بتحكي إنه إذا بدنا نحكي ب 350 كيس بيطلع لنا كيس واحدة فايبرويد or less حتى، فهذا إشي كثير rare. Next. Here we have a picture of the red degeneration. In the left, we can see the red degeneration lesion. as we said, it's red because of its morphology. It's red, and in the right there is a normal fibroid. Next, and here we have a cystic degeneration. Come on, next time. Okay, the risk factors. Aging is considered a risk factor, as I said earlier. It's because of the hormone and null-press and the obesity or high body mass index, family history, African. But here the oral contraceptive reduce the risk. يعني عكس الأشياء اللي فوق اللي بتزيد الريسك الأورال contraceptive reduces the risk. Okay. Now we'll talk about the subtypes. The classification is type according to the location of the uterus wall. يعني حسب وين الليرة اللي هي أصلاً معمولة فيها بنسميها. فعندنا 4 types: submucosal, subserosal, intramural, and cervical. Submucosal from the endometrium, بس subserosal near to the serosal level, and the intramural from the myometrium. فلو نيجي على الصورة هون على اليمين submucosa the blue ones هم اللي حكينا عنهم. intramural, submucosal, and subserosal. اللي جنب الانتراميولر تحت pediculated subserosal. Now the fibroids اللي بيكونوا very near the serosal level or the endometrial surface. فاحنا حكينا الاشياء اللي قريبه على السيروزال هي السبسيروزال، والاشياء القريبه عن الاندومتريال هي السبميكوزال. هذول الفايبرويدز may develop a pedicles فبنسميهم pediculated. فعندنا هون في الصوره على اليسار تحت pediculated subserosal، وفوق في الكافيتي pediculated submucosal. في اشي على اليمين broad ligament اللي انتم شايفينها هاي تحت. هسه الشغله هاي انكومون لانه الفايبرويدز بتطلع بمكان غير اليوترس زي البرود ليجمنت، وهالشغله يعني الكوز وراها حسب ما قرأت انها امبريولوجيك. اوكي تمام. هون عندنا صورة ثانية بتبين لنا انه submucosal fibroid, intramural fibroid, subserosal fibroid with pediculated subserosal fibroid. في تحت عندنا وحدة pediculated submucosal fibroid. المرة اللي فوق حكينا عن وحدة هاي نازلة عند السيرفايكل. الكوز تبع submucosal fibroids كان يعني by the uterine contraction انها تنزل لتحت زي هيك through the endocervical canal. Okay, next. Okay, now we will talk about the presentation. The most common presentation with 80% is it's asymptomatic, or in other words, accidental finding, abnormal uterine bleeding, and this bleeding can be heavy menstrual bleeding or intermenstrual bleeding, or reproductive failure, subfertility. So subfertility may result from mechanical occlusion or prevented implantation. Okay, has occlusion of the fallopian tubes or endometrial cavity grossly, but it prevents the implantation of ويمكن زي ما حكينا انها تصير prevent the implantation. The bulk effects or adjunct structure in the pelvis, pressure and pain, bladder or bowel dysfunction. إذا صار للبلادر أو rectum compression بتيجينا بسيمتومز bladder and bowel dysfunction. ويمكن يصير لنا abdominal distension بما انها يعني mass in the abdominal area. Okay, Amar. Now fibroids have some effects in the pregnancy. It can come with the recurrent pregnancy loss, abnormal or malpresentation, obstruction of birth canal, postpartum hemorrhage, and pain. Pain due to the red degeneration, as we said earlier, because of the necrosis and the hemorrhage, and the placenta previa.
Okay, placenta previa does not cause pain, but in general, fibroids can affect pregnancy by increasing the rate of cesarean section, which might be either due to abnormal lie or obstructed labor due to obstruction of the birth canal or due to placenta previa. Any lesion within the uterus will increase the risk of placenta previa. Placenta previas are painless in general. Okay?
Okay. وأنا هيك يعني خلصت، وعمل إن شاء الله راح أكمل معكم.